Hi, I'm Alex Colley. I'm a professor in the School of Public Health and Preventive Medicine at Monash and director of the Insurance Work and Health Group. So the health issue that the COMPARE project is exploring is how to most effectively return injured workers to work after an injury or an illness occurring at work. And we know that about 500,000 Australians are injured at work every year, and about 250,000 Australian workers make a workers' compensation claim for time off work and for medical care and treatment arising from those work-related injuries and illnesses. The most common health conditions that occur in those people are things like musculoskeletal disorders and mental health conditions, but they can also include a diverse range of illnesses and injuries such as respiratory conditions, cancers, severe traumatic injuries or cardiovascular disease. And we know that return to work can help people recover from their injury and illness, and the COMPARE project is really about helping people return to work after those conditions.
The impact of the COMPARE project has been on strategy, policy and practice. And I think one of the major reasons why this project has had such a positive impact on those areas is because it's been working in collaboration with every state, territory and government workers' compensation regulator around Australia, as well as some other key bodies. And we've been able to work collaboratively with these organisations to make sure that all of our findings are in the right context, and they've been able to help us interpret the results. The impact has come out in a number of examples, the first of which the COMPARE body of research has underpinned the first National Return to Work strategy, which is a framework that guides assessment of existing and development of new workers' compensation policy across all states and territories for the period 2020 to 2030. It's also led to a number of different methods that have monitored injured workers' health, return to work and healthcare delivery. The COMPARE team has been commissioned by Safe Work Australia to redesign the National Return to Work survey, as well as a measurement framework for the National Return to Work strategy. The COMPARE team has also supported new policy positions by key health bodies. For example, we have worked closely with the Australasian Faculty of Occupational and Environmental Medicine Policy and Advisory Committee to develop its recent It Pays to Care workers' compensation policy statement. And it's also informed design and implementation of new workers' compensation insurance claims management models, for example, in WorkCover Queensland, as well as new clinical guidelines for the diagnosis and management of work-related mental health conditions. So the outcomes of the COMPARE project has really helped to benefit not only the workers' compensation regulators and insurers, but also the workers themselves.
To me, excellence is striving for and achieving the absolute highest quality in our work, and we've demonstrated this as part of the COMPARE project in several ways. We've applied novel methods in our comparative effectiveness approach, including interrupted time series, to understand the impact of legislative changes. The project has also utilised existing national data sources in new ways and even developed new data sources. Our new multi-state healthcare database established during the project has provided new information on important aspects of healthcare delivery for compensated workers. We also helped to design the National Return to Work survey, which has established insights into claim processes, financial stress, and the role of employers in worker recovery. And finally, we've established long-standing relationships with and engagement with state, territory and Commonwealth government agencies responsible for workers' compensation scheme regulation and policy. And this has been a two-way, mutually beneficial relationship in which the government regulators have helped to define research questions and also disseminate our research into policy and practice.
The lasting impact of the COMPARE project is really to transform the understanding of what's called the compensation health effect. This is the counterintuitive but well-documented finding that injured people who make claims for compensation actually tend to have worse health and employment outcomes than those who do not seek compensation, even when they have the same kinds of injuries. And what the COMPARE project has done, it's been able to move understanding beyond just describing that effect, but to be able to answer the why and how questions by identifying which administrative or the employer characteristics or worker characteristics, and particularly policy factors that actually contribute to the poor health and return to work outcomes that happen that are associated with compensation. And this means that it enables development of policy and practice interventions that can actually reduce the harmful consequences of being involved in compensation schemes, and therefore support more effective return to work and improved health outcomes for injured workers.